Welcome to Health Tech Heroes, where we talk to innovators who are rewriting the DNA of healthcare. Today, we are excited to welcome Arsella Burton, a distinguished healthcare executive with over a decade of transformational leadership experience. Arsella currently serves as VP of Government Affairs at HealthX and a Vice President of Product Management at LTC Health Management Solution. With her DHA and MBA from Columbia University, she brings extensive expertise in healthcare operations, payer strategies, value-based contracting, and network development. Her impressive career spans roles at Central Light Healthcare and Art Care Advantage Plan, where she has consistently delivered significant revenue growth and operational improvements. As she states, it's not about having the right opportunities, it is about handling the opportunities right. Welcome to Health Tech Heroes, Arsella.
Well, thank you for having me today.
It's my pleasure, and I'm so thrilled to have you here today, Arsella. Your career spans multiple leadership roles across healthcare operations, including payer strategies and network development. What pivotal experiences shaped your career path, Arsella?
I'm going to tell you what really shifts my career path. A lot of people don't know this about me, but I am retired U.S. Air Force colonel. And when I got out of the military, I wanted to do something. I didn't know what I wanted to do. I met a gentleman. I was working as customer service in healthcare. I actually came up the ranks in healthcare. I was customer service on the phones, talking to customers when they would call in about a claim. Then from there, 6 months later, I was promoted to provider relations, and I worked with providers in healthcare. 6 months later after that, I worked into contracting. And from there, I was like, that's my niche. I really love how to do this. And I met a gentleman. I will never forget him. He's passed away, but he was a great mentor to me. His name was Harry Blair. And one of the things he said to me, he said, type of person that you can do anything you want to do, but the only thing that's stopping you from succeeding in your career is you. You allow white men to marginalize you for being a woman, and you allow white women to marginalize you for being black. You have to take what they're doing negative to you, make it into a positive, and show them that you're the smartest person in the room. And I thought, I don't think I could do that. But I notice now, as I've actually been in the career for a while, he was absolutely right. But there's a way of doing it, and doing it so that you could still have that humbleness within yourself. And also you show them that it's okay. Okay, if that's what you want to do, but this is my suggestion, and let's just see if it works. And just getting people to hear you, because there's a difference between hearing and listening.
I imagine.
Yes.
And throughout your career, you have moved from consulting to executive leadership. What motivated this transition, and how has your education background in healthcare administration influenced your path?
Well, I can tell you what really helped me transition from consulting back into executive was I needed to prove that I had a better understanding of healthcare, but all aspects of healthcare. I wanted to learn everything there is to know about healthcare, from policy to claims to operations to contracting to just dealing with government administrations when it comes to healthcare process, when it comes to healthcare Medicare Advantage plans. And I thought that by going through my educational, getting my doctorate degree and getting a master's degree, that was going to propel me, because as a person of color, you always have to prove that you're better than the next person. And sometimes we overdo it to prove it. And I realized I really didn't need to get all of that education to do what I had to do. But I think what it did was it gave me the discipline to learn every aspect of healthcare management, even from the technical aspect, because I came into health information exchange, thinking I really didn't know anything, but I realized I knew more than I was giving myself credit for.
I was just listening to something this morning, and what struck me was sometimes we give a lot of grace to other people, but once we
That's
start
true.
giving the same grace to
Yes,
ourselves, we might be a lot better off. I mean,
that is true.
and be a lot more confident about what we know and what we can do. Tell me, Astrella, I want to go a one layer deeper. Was there any pivotal situation that you remember, an incident or something that made you think deeply? That is why I'm asking this question, is because we can inspire ourselves, we can push ourselves to do something, but the way you have dedicated yourself and have excelled in this field, there are probably other factors that drive you. Is there something else you can share with us?
Yes. One of the things that, and I say this because I think of some of the things I did when I was doing my doctorate, when I was obtaining my doctorate education. I did internship with the UN. And one of the things that really inspired me, and I said, wow, I never realized this is what's happening, because when you think about public health and you think about international public health, you think that there's such a big difference. There is a difference, but when there is equity, when there is a lack of equity, it's no difference. Whether there's a lack of equity in the US and there's a lack of equity in Vietnam or Africa, or even in, because I was, when I did one of, when I always tell people I was actually with the UN, we actually went to Russia, and there is equity, lack of equity, and even in Russia when it comes to women's health. And I thought, women, when you think about all the accomplishment that women have done within healthcare, and we can talk about the great ones, but let's talk about the little unknowns like Henrietta Lack, whose cells live on, even though she died of cervical cancer at Johns Hopkins, but her cells lived on. And how the equity was not there. She didn't get the treatment that she deserved, but in her afterlife, she received the treatment. So why are we waiting until the afterlife to give treatment? And that was one of the things that inspired me, because I said, as a woman, and we all know women are the last ones to get diagnosed when they have heart disease, because the symptoms are not the same as men. Women are the last to get diagnosed when they have colon cancer, because their symptoms are not the same as men. And one of the things is that women take pain, they have a higher threshold for pain than men. So many doctors, even with postpartum, if anyone had children, I know you didn't have children, wife had children, but as a person that had children, even postpartum, oh, there's no, to think about that they didn't realize that was a thing until the early 20s, 2000s. Why is that? Because women are marginalized. And that was one of the things that was pivotal to me, is why are women marginalized? Why is it that when a woman have a symptom that providers don't listen to them? I wanted to be that voice to say, hey, listen, because if it's not for a woman, you wouldn't be here. Men would not be here. You need a woman to be here. And I think that because we are second class, we're treated as a second class citizen, even in 2025, that the only thing that we're really good for, women are still, we make less than men, even if we're in the same position. So why not make it an equal playing field? Because even though here in the US, they want to take out equity and they want to take out diversity, but you have to have that in order to have a great health ecosystem.
I honestly believe if this world was primarily run by women, we might be actually much, much, much better off. Honestly, and I have two children, and I saw what my wife went through on
Yeah.
the with the first child. I was like, "Are you sure? Don't you remember?" No,
Yes,
this
of course.
there is no way I'm doing it again. If it were up to me, I'm not even thinking about a
Of
second child.
course.
Nope.
Of course.
And just unbelievable what women can withstand, and with patience, and yeah, full on admiration. And yeah, I think there could be a disparity in salaries, but I think women should be getting paid more for everything that they do. The balance in the families, I mean, like majority, 90 women are managing it. Otherwise, it'll fall through. Holding full-time jobs and managing family.
Managing the household. And that takes me to my next that I would like to mention to you is if you look at the whole, like the executives that are heads of healthcare organizations, like your Fortune 500. Do you know how many women are head of Fortune 500 healthcare organizations? Oh, and when I ask this question, no one gets the answer right. They'll say, "Oh yeah, there's plenty of women ahead of the Fortune 500 health," but I bet you couldn't even name one.
I can. There are so few. If you want to
Right.
look at like a top level and not even looking at the healthcare, I'm just looking at general population, I can name very few.
And I always say it's even worse. So women hold executive positions normally in HR or in care management. And you think, okay, what about IT? What about provider contracting? What about government policy? So we have to bridge that gap because we are capable of doing it. I think I've always said to people, I've shown it. I've been capable in contracting, provider relations, and now in government affairs and in health IT.
And typically very male dominated
Very
industry,
male,
and
yes.
absolutely you stood your ground, and I'm glad you did. As a VP of Government Affairs at HealthX, what are your primary responsibilities and how does HealthX position itself in the health tech ecosystem?
Wow. HealthX has been, I think that we're on the forefront of the health ecosystem. And I'm going to tell you why. We're a health information exchange. So what that means is that we get data from all the hospitals, all participating providers that participate in the New York State health information exchange. And we get that data. We use that data for care coordination because hospitals, it gives a history. So let's take, for instance, you went to a hospital and we have your data because we have over 20 million unique patient records, right? And even so, you go to a doctor and let's just say you were treated 5 years ago for diabetes, but you have your diabetes under control. You come in the hospital and they're like, oh, but he's had his diabetes under control. His A1C has been normal, but it's a little high today. Let's see what's happening. They're going to be able to look at your history to see what could be the other underlying cohorts to make you come into the hospital that day. So if you, by having health information exchange, the one great thing that HealthX does is that we can help identify trends within a community and we can go down to a zip code level. So if we know that certain communities, like we have here in New York, we have certain communities that have a lower vaccination rate, and we know that in that community that they have X amount of people that have been infected with measles. We know that that's within that community, it's almost like pandemic. We also know in another community that we have X amount of people by that zip code that have a high risk of lung cancer. And what we do is we look at all those trends. We do predictive analytics to look at that trend within that community to communicate that to the health departments so that they can address educational and financial resources to curb that. And we have a lot of, and I see it's actually working because I see the commercials here in New York more so because I was traveling recently and I saw it more so because we have a high rate of people who are still smoking. Yes, even in 2025, they're still smoking, but we have a high rate. And I see the commercials and I see that they're using younger and younger people in the commercials to show that, you know what, hey, I need to sound the alarm. It's not cool for a 13-year-old to get a lungs transplant. You know, it's not cool for a 16-year-old to be sitting there waiting on a list for a lung transplant because they're vaping. Yes, they say, oh, I'm not smoking, I'm just vaping. So these are the things that HealthX does to put us on top of what's going on in the community and to help public health with education and financial resource. And it also helps with policy, making policy within the health department.
I wanted to ask, like, what was the reason for higher prevalence of lung cancer in that particular community? Looks like it's just that community has a habit of smoking more than other communities. Is there something else, or
Oh,
why does
yes.
that particular community has a higher prevalence of smoking? Is there any reason for that, or do we know?
Well, yeah, what we do know is that within that community, there is 117 smoke shops. There's only two grocery stores within that community. So when you think about health food deserts, it's a food desert. You also think about when you put things with the it's kind of like that law of if I see it all the time, I'm going to do it. So if you have 117 smoke shops within that community, within that zip code, and you only have two grocery stores, what do you think the prevalence is going to be?
Yep, it is just right on your face, like smoke, smoke,
Oh,
smoke,
smoke.
and more smoke.
Yes.
Yeah, yeah. If you have money, you can either buy food or buy a
Yeah.
cigarette. You go buy a cigarette because that's what is available.
That's what's available. And I think too, when you look at communities like that, you have to look at other factors. Yes, it helps that there's 117 smoke shops within that zip code, but it also helps that there's not a lot of community involvement to stop the smoke shops because they're looking at revenue. So smoking, the smoke shops actually increase revenue within the community because when you think about it, you're employing, if it's 117 smoke shops and there's no other way for people to earn income within that zip code that they can walk to, isn't it easier to go to the smoke shop and to be a cashier or to be a stocker or to be a warehouse worker? So that creates jobs. So when you look within that community, you have to look at what the community needs. That's one of the things that HealthX helps the community does. It helps the local health departments because we're going to see what the social determinants of health are and the social risks are within that community. So when there's lack of resources, we're going to tell that local health department, well, what we do see, this is what we see. We give them the facts. We don't give them and say, well, this is what we think is going to happen, but this is the facts. You have 117 smoke shops. You do not have any other means of economic development within that community. So how are you going to change that? And this is where policy is made.
I would have never appreciated the complexity of this until I heard you. And I know I'm just scratching the surface is that it's not just enough to educate people saying that, hey, smoking is bad for you, because they will say, I know, but I don't have any other option because otherwise I do not have any means to live. Essentially, if you want to do something effective, you want to replace what is in there. So the plan should start with how do we replace their economic system, bring that in place, then the education will be effective. Education first may not be as effective if you don't have a replacement for their livelihood.
Right.
So that nuanced approach, unless I talk to somebody like you, I would have never, never, ever appreciated. Thank you very much for that. So at LTC Health Management Solutions, you championed the development of new managed long-term care benefit for TRICARE for life beneficiaries. Can you explain how this initiative addresses healthcare challenges?
Yes. This is, I will say, this is probably one of the things that I'm most proud of in my career. As a veteran of the United States Air Force, it has helped so many. First of all, it helped 43,000 veterans in the upstate New York area that were eligible for managed long-term care. And what people I always like to say to people, you think that the government helps the veterans a lot, right? Because you say, I've heard people say, well, there's a hospital that they can go to, and you get low interest rates for housing. You can go to school for free, and you can do this. And I always say to people, until you've walked a mile in their shoes, you never know. Like I have been in the Air Force, and I tell people all the time, I have post-traumatic stress. I also have two Purple Hearts. But at the same token, I would not trade that for anything in the world. I loved my experience, even though it was a very abusive experience for me as a woman in the Air Force. It was very abusive, but I still liked the opportunity it gave me. What it does not give you, if you're not, and this is what people don't understand about the Veterans Administration, if you are not in that top 1 through 4 tier, so that means you have a service-connected disability, you have your medal award winner of, if you have a spouse that if you were part of Agent Orange or part of, now it's a new one, if you were in Camp, I think it was Camp Pendleton with the water, you're not allowed to go to the VA for free. So it's not free. So you would have to have, depending on your income, you would have a cost sharing at the VA. Even though I'm a Purple Heart recipient, I still have a cost share because of my income. It's a small cost share, and it's better than if I was getting prescriptions out with my commercial plan, because I can still get prescriptions for under $10. But there is some things that when you have managed long-term care needs, like all states that are part of ACA, the Affordable Care Act, they give dual eligible residents the ability to be part of a managed long-term care plan. But for veterans, if they don't fit one of those 1 through 4 tier categories, they are not eligible for home care, even though home care, they only give them 20 hours a week. And it really is based on the need. So people, even if you need 20 hours a week, you may only get 10 hours a week. You may not get to go to the daycare center. You may not get home delivered meals. So what this managed long-term care plan did is there's more veterans, especially the baby boomers, that don't qualify from the 1 through 4 that need the managed long-term care. Where do they get the services from? So the great thing that happened, President George W. Bush started the Community Cares. So Community Cares said that the VA administration would pay for services outside of the VA. So one of the things that he did, President Obama actually continued it, and it was to have managed long-term care for those veterans that were not eligible to go to the VA. And it was very hard to do, but it was passed. It was a pilot program, and it was really rewarding for me because the challenges were we could get more of those veterans to stay at home, which the cost was lower than to go to a VA home. Because once they went to the VA home, now all their Social Security benefits went to that VA home and their veterans benefits went to that home. Keeping them at home, it was more cost efficient. They lived longer and they had more productive life. I just thought it was the greatest thing. And because I had the experience working in a PACE plan, a program for all-inclusive care of the elderly, and I've worked in several managed long-term care plans within New York State, I was able to develop a program, and I knew exactly what were the pitfalls. I learned the pitfalls by working in a managed care plan and a PACE program and having to do coordination of benefit. What kind of software would I need? What products do I need to put in there? What type of predictive analytics did I have to have? And the population analytics that I had to have. So this was so rewarding for me. It was supposed to take 5 years and it took me 3 years. So I felt like my experience helped me to get it to, and just even the negotiation was easier for me because I've gone through all the operations of managed long-term care.
Sometimes when we look at a population, we see that, okay, we are actually addressing a significant amount of population and using the same system, how can we expand it? But what you have done is you have actually identified people who fully slip through the system and create another system to help them out so that it is dedicated for them. And that's so important that you don't forget people who have slipped through the system. Right. Because you are doing good for a significant of population. We still address, I don't know how big that population is who do not qualify for the 4 levels. But another thing that I know, I had a question based on this was it actually, I know it's not about money anymore. It's about making sure that people get help. But was it cheaper for VA to do this, pay for the community instead of helping the patients directly?
So we estimated that within the first 2 years, it would save the Veterans Administration, just because they weren't going to be at the veterans' home, it would save them an average of $18 million per year for the first 2 years. And remember, it was only 43,000. So if you multiply that by the number that are eligible in the whole United States, it's over 458,000 veterans that are eligible for this. And if you multiply that by that, and it really depends on where they are, because certain states are more expensive than others. You're talking about $2 to $3 billion in savings that it could go to other services, and it can go to even upgrading the veterans medical centers.
Everyone wins.
Yes.
You are a thought leader in this space. You have done some amazing work from just about every aspect of healthcare. Based on your extensive experience across healthcare operations and technology implementation, what do you think is the trend? Where do you see this industry going in next 5 years? Where it would go and where should it go? What can we do about it?
Well, I'm going to tell you, in the technology trend, we have to continue to incorporate AI in everything we do, because what we want to do is we want to have the people, and I always say the people resources are actually should be used more on innovation, and have AI do some of the manual work, like to do the data analytics that we're doing now. But what we need is people innovation. And what I see in the next 5 years is, I see that even though we're taking a step back right now, that we need to realize, even though we're taking a step back in healthcare, we need to take a step forward, because by taking a step back, where you think you're saving money, but you're actually not. You're actually spending more money and wasting resources. You have to incorporate AI for a lot of your tracking. You have to incorporate to automate a lot of systems. And there does come a time, especially with some of the baby boomers, that they want to speak to a person. So you have to be knowledgeable of all the benefits that are out there, and to be able to address their issues and in a timely manner. Because what I find by going out in the field a lot, yes, people love technology. They love what it could do for them, but they still need that human interaction. So I have interns that come to me, and I had interns last year. I'm going to have interns this year. One of the things that I always say to people when I'm looking for an intern, and they always say, "Oh, you're looking for people with technology experience." And I said, "No, because they're going to get that." What I'm looking for people to know is to know the basics of health information exchange operations. I'm looking for them to know the basics of health informatics. I'm looking for them to be innovators. I'm looking for them to be compassionate about helping people, because you can't innovate if you don't have a focus in mind. Because sometimes you can innovate and you can say, "I'll use this for evil," but we have to always remember that we have to help mankind.
Yeah, you used the word people innovation that kind of caught my attention very starkly. And you did explain that people innovation is not necessarily learning the technical aspect of it, but the aspect where it can be applied and actually end up helping people. That should be our end result. So considering that in about 5 years, you think people innovation is going to be the most important skill set?
Yes, I think people innovation will be the most important skill set, but I think I think AI is going to develop so much. Instead of people being afraid of it, they have to embrace it, because what it's going to do is make your work-life balance better. And it's going to get you more in touch with people. And I know this sounds ironic, because you think about all the social media, and people are always on social media, and it's like, I can't put down my cell phone. But I think what it's going to do is bring us back to that human touch, because everything we need to know, if you think about it, how long has Surrey been out there where you could say, "Surrey, tell me what the weather is like in Wyoming"? So we already know how technical innovation has advanced, but people innovation has not advanced. What I find with people is they're not empathetic to others. People are mean. They are really mean. Even when I see homeless people on the street and people ignore them, they've gotten so immune to them. But it's people and that person. What we've learned from COVID is that we need that personal connection. It's okay to have that iPhone or to be on your iPad and to communicate with people, but to have that personal touch with a person, that's where we need to come back to, because that's where we're going to live longer. And if you think about all the research of people in Japan that live to be 103, people in parts of Italy that live to be in their hundreds, people in parts of Africa, what's the one common denominator about that? And why are they living to be healthier?
Community.
Yes.
They take care of each other. That's amazing. And I think going forward, absolutely, I have a feeling that we might be able to fill up stadiums saying that, hey, all we are doing is networking. You just get an opportunity to come there and talk to each other and sell tickets on that. And like, yeah, you can fill up stadiums. Like this is, I'm predicting in 5 to 10 years, that's the thing. Like
Hopefully.
give people a reason to step out of their homes.
Right, right.
Yeah. And this is coming from a general leadership roles that you have played and your experience. And what will be your advice to an entrepreneur who is coming into this field or any field, in fact? What is that leadership trait that you really think is going to be key in this futuristic world?
I think what's going to be key, and it's key for me now, and I think it's got to be key for everyone in the future. I always tell people there's the 3 L's. You have to live by the 3 L's. Listen. It's very important to listen to what people say to you. And like I mentioned in the beginning of this conversation, there's a difference between hearing me and listening to me. So you have to listen to a person's conversation, even if they say something that you don't like. You have to listen to it because there's something that you're going to learn. That's my other L. Listen, learn, because you got to learn from other people. You have to learn from technology. You have to learn from situations, because that's going to help you to lead. And that's my 3 L's. Listen, learn, and lead.
Listen, learn,
And lead.
and lead. Not talk, talk, and lead. Nope. Listen, learn, and lead. Very simple. I think in communication, we miss the flip side of talking is listening. And I think that's a very important aspect of it. And LLL is something that you coined.
But it was something that I always thought about it. And I think about, if you're going to show your true success, how do you measure success? From listening to people, listening to even the criticism that people give you. Because I always tell, I even tell young people that I work with that you cannot be a success until you fail. So you have to listen. You got to learn from your failures, though, because if you continue to repeat it, you're just going to continue to fail. So you have to learn from that, and you got to be willing to learn. And then once you listen, learn, you got to be able to lead others. And it's not going to, I always tell people that our President Obama always said, much is given, much is expected, right? So if I have something to give to you, even if it's just a word of encouragement to say to you today, wow, this was an excellent conversation that we had, and it impacted my life today. You're going to take that. It may not mean that much to you right now, but maybe 2 years from now, you'll say, I was speaking to Arsella and she said that impacted her life today. And that's going to make you, because you listened to me, you're going to learn from that, and you're going to want to impact someone else's life. And that's how life should be. And even when you think about technology, how is technology impacting someone's life? Is it helping them for the better? Because if it's not going to help you for the better, I don't need the technology. And that's one of the things that we do at HealthX. If it's not going to help us, we're not going to offer you to you. If it's redundancy or if it's something you're already doing, it has no meaning. But if I listen to you and you tell me what it is that you want, I am going to learn how to give you what you want so that you can lead another generation.
Wonderful, Ursula. This brings us towards the end of our podcast. One last question. It's an open-ended question. You have 90 seconds. You can take 4 minutes. But if you have missed something or if you want to reiterate something that you already said, it's fully up to you. The time is yours.
Well, I just want to say to all young women, don't let people tell you you can't, There's no such word as I can't or you can't, you're not good enough. If you want to do something, you need to do it. Don't let people discourage you, because you're never going to be a good leader if you allow people to discourage you. You take that discouragement and use it as something positive and say, you know what, you told me I can't, I'm going to show you.
That was very powerful, and thank you very much. And I
Thank you.
think that veil of masculinity is getting broken, and I really look forward to seeing powerful women come out and do what they're absolutely 100% have been always capable of. Let's see, we will have perhaps more leaders in next 5 to 10 years in the healthcare area, women leaders.
Yes, we
And
will.
with that, Arsella, really thank you very much for your time, and I truly appreciate for everything you do for the community and here today visiting us at Health Tech Heroes.
Well, thank you so much. Pleasure.